I'll shift, if we could, to the next major topic on business models and business model evolution. What are the most interesting business models that you've seen emerge or are emerging in healthcare?
Here's how we're thinking about it, and I don't know if this is right or not. I'm sure I'll get some
Probably
feedback.
not.
Yeah, I already did. So I won't even have to say it. So if you imagine kind of a 2x2 matrix with your business model on the vertical and your care model on the horizontal.
Yes.
I think what we're really talking about is that intersection between how you get your money and then how you deliver the care. And for us, in our system, 2/3 of our money comes in a budgeted or fixed payment manner, and 1/3 is still fee for service. So the question then we ask ourselves is, so what are the implications of that for our hospitals? And it turns out that the implications for our hospitals are not as dramatic as you might think, because the incentive in the hospital is to manage that episode of hospitalization as efficiently as possible. And we are rewarded in fee-for-service, and we're rewarded under capitation if we do that. So that was kind of a breakthrough for us, because I think you can get into this thinking of saying, well, the hospital closes, there's no more hospitals, and they're radically redefined, and that is not our conclusion. Where the big change occurs is the outpatient care model and all the things that you string together in a capitated world that
Yes.
Craig's organization does, that CareMore does, that can add additional value and allow you to succeed under a capitated payment.
There are so many different elements to the care delivery model and so many different sectors and silos. No one part of that equation the question is can any one part of that equation do enough disruptive innovation in and of itself to influence the whole, what was the word you used? Not continuum, constellation of elements. So where my head then went was, I think what we will see the new business model being are the organizations that have the insight to bring the silos together. I think that's where the innovation is going to occur. Where we have been broken is we each think of our own sectors separately. That organizations that will think of a way to align incentives, align goals, forge partnerships shoulder to shoulder, not just vertically, I think that's where we're going to see the most dramatic change in the business model.
So kind of building on merging silos and collaboration, it's who are the players that aren't in healthcare right now who are really good at that, who are really good at integration and producing value in this new order, and are those partners that we should be looking for, or partners that you anticipate will enter?
The biggest failing in healthcare has been the integration, and it is truly those who lead in the path of integration, which can either be done as Jim or David are through common control governance, or through virtual, or through a combination of collaborations and joint ventures. And I think all of them, there are models of success. I will say, having been involved intimately in integrated organizations for decades of time, the owning of them is the most complex managerial structure. So the more every business segment becomes more vertically integrated, the higher degree of complexity and challenge at the management site. So I think you've got to really assess. One of those assessment things you do is not only do I have the scale, the depth, the talent, the financial resources, access to capital to do these things, but do I have the ability to manage the complexity of what I'm undertaking? Because there's lots of examples of failed strategy when I do a bolt-on and don't change anything. My second point, which maybe is a little bit at getting at your question, is I haven't heard the word home yet in the conversation. But I think, and I'm part of a think tank group that's working with people who design the standards for designing healthcare organizations and licensing them, and they asked us to convene a group to talk about 20 years, what would it look like? And the conclusion would be everything in the home that can possibly be done and all technologically enabled.
I would venture to guess that most of our organizations, from a capital investment perspective, spend more on IT than anything else and project to do so in the future. And so what does that mean? It's really a bet to the future, to the solution of breaking down silos and improving processes, but more importantly, engaging the consumer. And when you look at business models that have been successful over the last few years, they're all focused around internet and IT, whether it's Amazon, Priceline, amazing new models for the future. And this is a significant investment that we're making in our system in terms of acquiring our own IT organization that's focused on consumer connectivity through the web and through devices. And so clearly there's some excitement in that direction, and we're making those investments, and I think that's going to be the key motivator for improvements in the future.